My name is Shelley Jeske, and I'm the manager of the Simulation Learning Center at Mount Royal School of Nursing. I'd like to welcome you to our new space. It's being officially opened April 7th, which is tomorrow, and we're really excited to show you around. Right beside me here are an example of two of our mannequins, Hal and Susie. And as you can see, they are fully operational. Their eyes are blinking. They are breathing for you. And what's great about this equipment that we've purchased is that it's very portable, so we can use this equipment anywhere. It is not just delegated to be used in this space. So our faculty members can take these mannequins into the classrooms. We can use them in the hallways. We could use them in the rec center if we wanted to, out in the parking lots.
Where's that?
Just to show you the versatility yet again of the center that we've set up here, this room has been set up as a pediatric environment. So this is our 5-year-old Hal. Hal is set up in this room that represents a child's environment. And so our students who go through their child health rotation will be able to practice in here prior to going out into the child environment at the Alberta Children's Hospital. This is an example of one of our clinical environments that we have. We have 4 simulation suites in this area, and they can be set up in a number of different ways. So this is a clinical space. As you can see, it looks very much like a hospital setting, and everything in here is functional. And as well, we have one of our mannequins here. Hello, Susie.
Hello.
How are you this morning?
I'm feeling fine. A little short of oxygen, though.
You're a bit short of oxygen. Do you think I need to turn up the levels a little bit?
It just seems it's difficult to breathe.
You're having a hard time breathing. Okay, maybe I'll sit you up a little bit.
Okay.
Is that a bit better?
That feels a lot better. Thank you.
You're welcome. These mannequins, we can check their pulses. They have lung sounds and heart sounds. We can do pretty much anything with them that we would a normal human being. So that's what's really great about this center, is that the students come in here and get to experience something that's very realistic. Anytime that the students need help, there is a telephone here, and the telephone can call into our control room. The control room is behind the one-way glass that you'll see, and the students can't see behind that glass, but we can see into this room as an operator.
Hi. How are you doing?
I got a cough.
You got a cough. Can you take a few good deep breaths in for me? Definitely got a cough. Or not? How long have you been sick for?
Oh, a couple of weeks.
A couple of weeks. Do you have a fever? So his oxygen is 92%. My name is Alyssa Nadeau, and I am from Edmonton. I did my clinical placement at the University of Alberta Merge, but I'm also doing my ACCN courses here at Mount Royal University to gain some practical experience in emergency. I came down today to do the simulation lab in Calgary to gain some practice prior to having some critical situations happen in the hospital. I've done sim before, and I have seen it work well, especially in patients that we typically don't see that often, such as a patient requiring CPR, a patient getting very septic, and that way we've at least run through it once, so when that actually happens in the real world, we know what to do, what kind of things we need to prepare, and to gain a little bit more confidence in our skills.
I'll take you into our control room and show you what goes on behind the glass. This is Lori Malinowski, our SLC coordinator, and she's been behind the glass operating the mannequin for me. And so she has the capability of adjusting the mannequin's vital signs, any of its responses based on how the students are engaging with the patient. It's a great way to provide feedback to the students about how they are performing and how they are intervening. She is also the voice of the mannequin, and you can see the headset that she's got on, so she can hear what's going on, and she can see either through the one-way glass, or we also have a very sophisticated audio-visual system in here that has 3 cameras that capture the events that are occurring. We also can record from here and then play back as needed. This room shows an example of how we can convert our clinical room into a home environment. So that is how our staff have set it up for you today. We're able to cover over that clinical head wall with a curtain and set it up to look like we are in Hal's home. He's sitting here in the chair watching TV, and the students would then come in and visit with him and perform their assessments that they would when they go in for home visits. This is one of our 4 debriefing rooms. The most important room in the area itself, actually, because this is where the students come and talk about the situation after it has occurred. Typically the way we set it up is a small group of students will go into the scenario, while the remainder of the group will sit in here and watch their colleagues performing in the scenario on a live view. As well, we can have the students come back into the room after the scenario is complete, and their instructor will debrief with them about how things went. This is truly where the learning occurs, and we also have the capability of playing back different parts of their scenario that were captured by the video cameras. Thanks so much for touring our center today. It's been a pleasure to have you visit, and Hal and Susie are happy to have met you as well.